Women of childbearing age in maternity care deserts across the country see no relief ahead as hospitals across the U.S. continue to shutter labor and delivery units. Our Faith Abubey visited some of the areas to speak with the people most impacted, including on Yakima Nation grounds in Washington state.
We're getting back into our normal lives.
Early on in her pregnancy, Tori Wafsheli made plans to deliver her second child in the same hospital as her first, Astria-Toppenish Hospital on the Yakima Indian Reservation in Washington state. But with just 3 months left to go, the hospital suddenly shut down its labor and delivery ward, leaving her scrambling.
I think it was just nerve-wracking.
As the shock spread across the Yakima Indian Reservation, many other pregnant women realized that they too needed new plans, and quick. Sierra Wheeler was more than 7.5 months along. The hospital closure would mean a 45-minute drive to the nearest delivery unit.
Just being so far out here, Toppenish was the place that would have worked easier.
Options for maternal care on the reservation have gone from bad to worse.
It's like really troublesome and disheartening, but not surprising.
The Yakima Indian Reservation spans more than 1 million acres, and pregnant women looking for care are often forced to travel roads that can easily become dangerous depending on the weather.
This area is very rural. It is isolated, so the traveling distance plus the resources that are needed to get quality care are not there.
Jessica Whitehawk founded the Tatawach Birth Justice Center with the help of birth advocates Leslie Swan and Simone Dittenholler.
It's a fresh light.
These women with backgrounds in maternal care are on a mission.
We're providing a safe space, whether it's for 5 minutes to an hour. We invite all of our moms to come back and take a load off.
Let's get baby's heartbeat.
Dr. Anita Showalter schedules clinics at the center every Wednesday to see pre- and postnatal patients.
Every woman deserves to have good care. Every woman deserves to have personal care. And every woman deserves to have her baby in a safe place.
A recent March of Dimes report found that over a third of U.S. counties are maternal care deserts. That's more than 2.2 million women of childbearing age and 146,000 babies born in areas without obstetric providers or hospitals or birth centers offering obstetric care.
Obstetrical units in hospitals have been closing across this country, and obstetricians, we're not increasing them at all across the country. So think about 1 in 8 has no access to a place to be born.
Dr. Elizabeth Chereau says part of the reason is limited funding. And as a result, the maternal care deserts contribute to the high U.S. maternal death rate. A new CDC report shows that in 2021, there was a 40% increase in the death rate from maternal causes in the United States compared to 2020. After a spike during the pandemic, preliminary data suggests that the number of maternal deaths began dropping in 2022, but the numbers were still higher than experts would advise. Mississippi is among the states with the highest number of maternal deaths. That's where Byron Stribling lost his wife and unborn child.
We don't have a hospital. We don't have an emergency room. The nearest hospital was about 15, 20 miles away, give or take.
In the summer of 2021, Byron's wife, Harmony, was 5 days away from delivering their first child together. They'd already picked out her name, Harper. But on the night of July 4th, Harmony wasn't feeling well. Byron, suspecting something was seriously wrong, decided to take her to the hospital.
I thought she was having a seizure. She was shaking, eyes rolling in the back of the head.
Byron pulled over to perform CPR. Paramedics arrived 15 minutes later, but it was too late. Harmony and the unborn child died on the side of the road, about 3 minutes from the hospital.
Now we have multiple people that's dead because of a situation that could have probably been prevented if we had a hospital or something like that nearby.
They don't have any obstetric providers, over 50 counties. That's really, really worrisome. This is a crash course in obstetrics.
Rachel Morris, a maternal fetal medicine specialist at the University of Mississippi Medical Center, and her team have been trying to fill the gap.
Put your hand right here.
Training well over 400 first responders in parts of the state that lack maternal care.
There you go.
On how to step in case of an emergency.
We teach you how to intubate a baby. We teach you how to deliver a baby.
So this is not something they're supposed to be doing.
They're being forced to do it because of these deserts. Push, 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 push. Almost 90% of the mortalities we had over a 2-year period were deemed preventable.
How do you wrap your head around that?
That's why I'm here today. It's frightening. It's frightening. Something's got to change.
Things are changing, but not for the better. Since 2020, an additional 16,000 women have no nearby maternity care in the U.S.
Hospitals are closing. We understand that it disproportionately impacts women of color and older women.
According to the CDC, Black women have a 3 times higher maternal mortality rate than non-Hispanic white women, though all ethnicities did see an increase in 2021. Women over the age of 40 have a 7 times higher mortality rate than women under the age of 25.
Feeling okay today?
Yes, ma'am. At 38 years old, Dominique Armour is considered to be in her advanced maternal age. She's pregnant with her 10th child, putting her in a high-risk category. She tells me this will be her 4th time driving across state lines from Arkansas to Mississippi to give birth because she has few options.
My last baby, I almost had on the side of the road.
The only hospital in the county hasn't had a delivering physician in more than 5 years, and access to prenatal care is also limited.
This is my last baby that I'm going to have, so I just wish they had a doctor here.
Dominique is currently 8 months pregnant.
When was the last time you were able to see a doctor?
I think when I was 3 months, 4 months. It was hard because I had to go by myself. I don't want to talk about it. I don't.
A lot of women do miss appointments because they don't have transportation.
How many women, pregnant women, come to the center who are in the same situation?
Just about everybody. Do you have somebody to drive you?
Alice Rogers with the Arkansas Birthing Project is exploring options like this March of Dimes mobile clinic to get women in the area access to more care.
This unit is doing what it can to provide services to the women.
It's just not enough.
It's just not enough.
Ohio has had the most women impacted by overall reductions in access to care since 2020.
It's heartbreaking. I think about the United States as some place that should be on the top of the forefront, yet we have the worst outcomes.
Back at the Tatawakcha Birth Justice Center, the founders are working to expand their services, hoping that one day they can build a new birthing facility on the Yakima Nation grounds.
We're trying to rebuild our kinship, our nationhood, our family strength, providing a safe place for our families and women and children to come, to have more options, to be cared for and to heal.
Our thanks to Faith for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.